Imagine this. You're a medical provider. You have a patient with a problem, maybe even with a life-threatening condition. Your entire training, all your experience, the oath you took, all of it tells you exactly what you need to help this patient. But you hesitate. Why are you hesitating? Well, you hesitate because there's a law written by politicians, not medical professionals, that can land you in jail or cause you to lose your license just for doing what you know is right for your patient. Now, unfortunately, this isn't a scene from a movie. It's the reality of medical providers right now all across our country. Now, this isn't a political video. It's really about the fundamental practice of medicine itself and how I think it's changing. It's about the freedom to treat your patients based on science, on evidence, and on a shared sense of humanity. It's about not being used as a pawn by politicians to advance their agenda. Now, I'm not naive or stupid. This has been happening in some form forever, and I don't agree with all the medical doctrine that's out there right now. But I think things have taken a new and dangerous turn, and I want to discuss that. I also want to see if you feel the same way that I do. So, we're going to look at 3 different circumstances where I believe providers are being kind of coerced by the government. Now, let's start with the situation that's happening in emergency rooms today. So, a woman comes into the ER. She is bleeding heavily. She's in distress because she's having a miscarriage. But the miscarriage is incomplete, and she still has retained fetal tissue in her uterus. And if that's not removed, then it can easily lead to a life-threatening infection. Now, as an emergency room provider, your training says that this is a straightforward case. The patient should have a DNC, a standard procedure, to clear the uterus, to stop the bleeding, and to protect her from that potentially life-ending infection. It's not complicated, really. It's pretty straightforward medicine. But in many states now, that same procedure could be seen as an illegal abortion. The laws are often vaguely written with no clear exception for medical emergencies. Now, this means that the provider is forced to make a gut-wrenching choice. Do you perform the standard of care and risk becoming a criminal? Or do you wait until that patient is so sick, until she is literally at death's door from the infection, so that you can say without a shadow of a doubt that you acted and did the procedure to save her life? This is a real and terrifying dilemma. Major medical groups like the American College of Emergency Physicians have spoken out about this, saying that these laws force doctors to violate their ethical oath and to put patients' lives at risk. This law isn't about ensuring public health or protecting patients from quackery. This is about using the law to force providers to stop providing a specific medical treatment based on political and moral beliefs. Now, let's look at another example. This time it's not about life or death in a single moment, but more about the long-term health of a vulnerable patient, particularly a minor who may feel that they are transgender. Now, before we go any further, I'm going to say that I haven't researched transgender medicine, haven't looked into the research and the findings. I don't even know how I feel about people, especially kids, transitioning genders. But again, the point I'm trying to make is that it's not about these specific conditions and how you or I feel about them. It's about how government is directly influencing the practice of medicine based on ideology. As it stands now, medical organizations like the American Academy of Pediatrics and the AMA have clear guidelines for gender-affirming care. They are comprehensive, evidence-based processes that start with counseling first and mental health support. But now, states like Alaska are trying to make it a form of unprofessional conduct to provide that care. And this isn't just like a political statement that the state is making. It is a direct threat to a provider's career because unprofessional conduct means that a medical board can fine you, suspend your license, or even take it away for good. And you may say, like, well, yeah, but that will never happen. Maybe. I mean, how do you know? What happens if the medical board ends up being made of people who share that same ideology? When a state labels any part of gender-affirming care as unprofessional conduct, it opens the door for a therapist or a pediatrician to be penalized or even lose their license for simply providing counseling. I think this creates a dangerous precedent. A provider could face punishment for providing care that is recommended by major professional medical organizations. So, regardless of your personal view on gender affirming care, this should be alarming. At least it is to me. Because, in my eyes, it means that any medical treatment could be deemed unprofessional in the future if an administration decides that it's against their agenda or against their beliefs. We may be heading into an era where you don't look up what the standard of care is medically, but instead you look up what the prevailing political views are at the time and let that direct your care. Is that what you want? Now, these two situations that I highlighted are happening at the state level, but this kind of pressure is now also happening at the top level of federal government. So let me kind of set the scene for you. For decades, vaccine policy at the CDC was decided by a group of independent experts called the Advisory Committee of Immunization Practices, or ACIP. It was a rigorous science-based process. The 17 members of ACIP were highly credentialed physicians and scientists who had deep expertise in pediatrics, infectious diseases, public health, and vaccination science. They were chosen for their broad knowledge to ensure a rigorous scientific review of vaccines. They also were not allowed to receive any direct industry funding by ACIP rules to ensure neutrality. Now, I have to say had and use the past tense and all that because the new Health and Human Services Secretary, RFK Jr., fired all 17 members of that committee and replaced them with only 8 people. And only 3 of those 8 people have relevant experience with vaccines and immunology. And some of the new appointees are known for their very vocal skepticism about mainstream vaccination policies and have been vocal critics of public health responses to the COVID-19 pandemic. A few have even served as expert witnesses in litigation against vaccine manufacturers, which runs counter to previous ACIP rules. So soon after that happened, the American Academy of Pediatrics made a strong recommendation for children to get COVID-19 vaccinations. It was a recommendation based on their own review of the science. But then what happened after that? Well, RFK Jr. responded with a public warning on X. He took to social media where he said doctors who follow the AAP's advice and recommendations might not be protected from liability under a law called the Vaccine Injury Act. This was a veiled threat to providers. You give the vaccine, you may become liable. But here's the thing. Not only was it a veiled threat, but it was also a misleading threat. As legal experts quickly pointed out, COVID vaccines for children were never covered by that specific law. The secretary's warning had no legal basis. It was a public statement designed to create doubt and fear among doctors and other providers. It was an attempt to influence how clinicians treat their patients, not with facts or with data, but with a false warning of legal risk. This gives me chills. Openly sending veiled threats through social media to healthcare providers? To me, this all seems unheard of and unprecedented and scary. But I would ask the question, is it really? Some may argue that the government has always had a say in how we practice medicine. And I do think that's true. The government has been in the business of regulating medicine for a long, long time. And I certainly have never been blind to what our government does or have faith or belief that they always do things in our best interest. However, I feel like the government's role in healthcare has mostly been about protecting the public. The FDA was created to stop companies from selling like quack medicines and poisons. Public health mandates throughout history, the history of the country, have required quarantines and vaccinations to stop epidemics. And the government set up Medicare and Medicaid to ensure that millions of Americans could get medical care. And of course, I'm sure along the way, they have protected pharmaceutical and insurance companies in everything that they do as well. But I do believe that historically, government intervention was largely about ensuring safety and efficacy in medicine. And it was about making sure that providers had safe tools to work with and guidance, and that the public was protected from widespread disease. So, what do I think is different now? What do I think is changing? Well, in the past, where the government felt more like a partner in a shared mission of public health, now it appears to be a tool for enforcing an agenda, regardless of what science says. The doctor risking jail time to save a life, the pediatrician facing disciplinary action for gender counseling, and the family physician being warned about giving a vaccination, these things scare me. And it doesn't feel like it's really about following science anymore or protecting the public. Instead, it's starting to feel a bit like coercion to bring the medical establishment in line with certain ideological beliefs. And what really worries me is that I think this is a fundamental shift in healthcare in America. When a provider can't treat a patient without fear of a prison sentence, or when a state board can strip you of your license for implementing a treatment that is supported by medical literature and endorsed by major medical societies, then I think we've crossed a dangerous line. We need to think about what we fundamentally want in our healthcare system. Will we be allowed to use evidence based medicine and shared decision making with a patient to help them where they're at and follow their desires? Or will we allow politicians to decide what is right for the patient? Are we comfortable with letting politicians decide for us what we can and cannot talk about with our patients? So I'm curious to know, how do you feel about this? Do you think I'm just exaggerating things and that I am kind of fear mongering? Or do you think that this is nothing new and it has been going on for ages? Or maybe you agree with the stance that the government is taking? Or does all of this bother you and do you think politicians are overstepping? I really would love to hear your thoughts and have a discussion about it because I don't know everything. I'm just watching all this, as a medical provider and wondering about what's going to happen. So leave me your comments down below in the comment section. Remember, please keep it civil. Let's have intelligent debate. Now, if you want to see me voice my opinion on another controversial subject, check out this video here where I slam the AMA for what I feel is a smear campaign against PAs. Thanks for joining me, and as always, take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.